Now, you had one of the biggest surgery anybody can get in the thoracic spine just about 2 weeks ago. Is that about right?
Yes.
So tell me about your symptoms before the surgery.
I had pain radiating around my ribs. It would affect my breathing because if I tried to take a breath, it just shot around, and I just never felt like I could stand up straight.
How long was it going on?
Oh, I would say, oh man, at least back as far as 2014.
So about 6 years.
Yeah.
Now the pain was in the back, in the chest area, and it was turning around the chest to your chest area in the front even. Is that right?
Yeah.
1 to 10, how bad was that pain?
It was getting to be about a 7, and just there was no relief for it.
How is that pain right now? The part that goes around the chest.
Well, it's good even post-op. I mean, I have post-op pain, but no, I don't.
That pain that was turning around the chest is gone.
Yeah.
Okay. Now, when did that pain go away?
I would say the day I was discharged, I noticed.
Which was 2 days after the surgery.
Yeah, I just think that
Yeah.
it was so present for so long that I actually realized it's not there.
Yeah, that is now. And let me turn around and show you what we did. You got a 3-level T9 to 12 thoracic interbody fusion. It's a procedure that we invented actually, because alternative to that, which we did minimal invasively, we would have resected for that many levels. We would have resected 2 ribs just to get in. Just take a bad disc out, put the 3 spacers in, and here are the 3 spacers. And then we would have put screws in the back, and that would have required at least an 8-hour surgery, a cardiothoracic surgeon opening it up for us. This is part of what we see there. And that sort of shows what the problem is there, and where we fixed it here. And practically that surgery was done in less than 90 minutes, and you stayed just 2 days in the hospital. Our blood loss was 99 cc, which is about 3 ounces, which is nothing for this kind of surgery. Now, are you able to do basic daily activities yet, or is it still difficult?
No, it's not terrible, but I'm doing it slow to be cautious. But no, I make sure I'm up. Yeah. And I've been doing long flights of stairs.
Yeah, and
carefully.
Considering that what you went through after open surgery for something like that, you would be probably still in the hospital. You would be probably about 5 days or even maybe longer with the tube coming out of your chest in the ICU. Exactly. So, because we would have needed to open up your chest, collapse your lungs, and so on and so forth. All of that wasn't necessary because we did it with a minimal invasive technique.
Absolutely.
Now, any question, any comment?
Me being a healthcare provider myself, and from my own back history, having lumbar surgery, they weren't willing to do the open procedure on this thoracic area.
Because the risks were too high to open up fashion way,
I thought I was going to be stuck that way for the rest of my life.
Yeah.
And I'm not.
Well, I'm really happy. Thank you. And then the feedbacks like that make a surgeon's life worth doing what we are doing.
Exactly.
Well, thank you so much for the interview. I appreciate that.